Our next case has got a different teaching point and a little surprise.
There was a female patient, 30 years old. She came to our hospital and complained about pain in the back, in both flanks, and in the right upper quadrant. She already had a stone in the urinary tract years before, and she was sure that there's a problem with the kidney. So a younger colleague of mine did the scan of the right kidney in transversal and in longitudinal scan. Do you see anything? Over here we see the green margin shows where the liver is, and the purple one the kidney, and in the inner area of the kidney there is the renal pelvis, and there is no dilatation, there are no stones, no liquid found. So I think there's no problem with the right kidney. But we went on scanning the patient, and another organ get into the view over here.
I think the gallbladder is quite full, and I can see an object over here which is white, hyperechogenic, and could be gallstone.
Maybe, so go on. And here we see the gallbladder filled with bile, it's anechoic, and over here we have this bright area, this bright reflex is the gallstone, and behind the gallstone there we see acoustic shadowing, which means there are no signals from ultrasound from behind the gallstone because they are blocked at the surface of the gallstone. So behind the very dense structure, like a gallstone or ribs or bone, we have no signals, which means acoustic shadowing. So I told the patient, we have got the problem, a gallstone, and you have to be operated.
And did that explain her pain?
To me, yes, but the patient told me, don't mention the gallstone. I have got this gallstone since years and there's no problem with this. And other doctors also told me this gallstone will never make any problem.
So what did you do next?
The thing was, when I touched the gallbladder with the transducer, the patient told me about pain. So I knew the problem is the gallbladder and not the kidney.
So it's a positive so-called Murphy sign, isn't it?
Correct. I went on scanning. And do you think anything is wrong in this picture? Or is there anything
Yes, I see another object over here with acoustic shadowing. So maybe there's another gallstone.
Correct.
And this one at this place could cause a lot of pain, I think.
I displayed already the answer. There are two gallstones, two shadows, two gallstones. One of the gallstone is located over here and blocks the flow of bile, so the patient has got pain and the colic caused by gallstone.
So what about an operation now? Did the patient agree?
Yes, finally the patient agreed because we showed her both gallstones, and when we performed the scan and she felt the pain while I'm scanning the gallbladder, she was
convinced.
That's the problem. And we told her 2 gallstones are the same price in operation than 1 gallstone.
So she was convinced then?
She was convinced the operation was done and the problem was solved. So key point number 1 is, when I touch the organ and the pain occurs, I've got the problem found with sonography.
And the second point is that it's not so difficult as you might think to scan the gallbladder with ultrasound. And it's also not so difficult to detect the stone. Maybe it needs some more expertise to detect the second stone, but we will teach you all of this in our course of basic abdominal sonography.
So let's get this expertise and try to find the gallbladder. We go on with scanning. Where do we expect the gallbladder? The gallbladder is inferior to the costal margin, in the middle of the right upper quadrant. When we perform the physical examination, we put our hand here, put pressure on the patient's abdomen, and ask the patient to take a deep breath. Please press in. We try to feel the gallbladder and test if there is any pain the patient reports. The same procedure is made by the transducer. We put the transducer over here, put gel on it, and find the gallbladder, ask the patient to take in a deep breath, and when the patient reports about pain, we know there's an inflammation and a positive Murphy sign, the positive sonographic Murphy sign. Diseases of the gallbladder are the most common indications for abdominal sonography. Sonography can answer the question whether there are gallstones with or without inflammation, if there are biliary obstruction, or whether there is a tumor or something like this in the gallbladder. In order to achieve the best examination conditions for sonography, it is important that the patient does not eat anything 6 hours before the scan. So no oil intake will improve meteorism and will enlarge the gallbladder. So also chewing gum, coffee and smoking are forbidden. We have to keep 3 things in mind. First, ask the patient to lie onto his left side and raise the arm above the head. Second, take plenty of gel. The more gel you use, the better the view. And third, give the command, please breathe in and hold your breath as long as you can, and afterwards go on breathing normally. Place the transducer at the midline of the patient's abdomen and make sure to keep in contact with the costal margin. Now, transfer the transducer along the costal margin to the right side of the patient and follow the picture on the screen. When we will do so, we can see the inferior border of the liver. And when we follow the costal margin, we can see the gallbladder over here in a quite longitudinal scan. In order to achieve the best picture, we have to rotate the probe clockwise or anti-clockwise to get the gallbladder as large as it could be on our ultrasound machine screen. So this is a perfect image of the gallbladder. Now we can do our measurements. The diameter in the longitudinal scan of the gallbladder is up to 8-10 centimeters. In the cross scan, the diameter is about 4 to 5 centimeters. We can also see the bile, which does not contain any echoes, so it's a black echo-free area inside the gallbladder, and the wall of the gallbladder is quite bright, hyperechoic, and we can measure the thickness of the wall. We have to make a sweep through the whole organ, and we are looking for stones, wall thickening, sludge, or even tumor. Nothing of these findings can be seen here. It's a normal, healthy gallbladder. So, when we found the gallbladder in the longitudinal scan, we have to perform a transversal scan. So, we rotate the plane 90 degrees counterclockwise and keep the gallbladder in the middle of our screen. And the same procedure is done by tilting the probe upwards and downwards, so we can be sure that there are no stones, inflammation or something else. So we scan the gallbladder in 2 planes. In the longitudinal plane with a sweep to the patient's left side and the other way around to the patient's right side. And in the transversal plane, in the cross scan, when we rotate the plane 90 degrees counterclockwise, we perform a scan tilting the probe downwards, which means the cable came upwards, and the other way around, tilting the beam upwards, so we can see the entire gallbladder in 2 dimensions. That's very important, and we perform this kind of scan on every organ in the abdomen. Gallstones, liver metastases, and problems with the bladder, that's what we have seen so far. But there's much, much more in our course of abdominal sonography.
And it's not so difficult. You can learn it too. We are there for you, and we will teach you everything you need to know to help your patients.